Hi, and welcome back. I'm so glad that you're staying on because this is the best part of the evening. When we're really going to dive into the specifics that were mentioned in the film and how to get help and answer questions. So I really want to encourage everybody to start putting questions in the Q&A. I'm going to start by talking to the panelists, some typical questions that we get and some things that we definitely know that could be helpful. But I'm definitely going to be watching that Q&A and want to make sure we can get to as many questions that you have. So let's just start with, I want to go around the room, so to speak, and have everybody introduce themselves. And if you could just say really quickly, maybe in a minute or less, if there's anything specific in the film that really resonates for you and your life or your work. And so let's start with Vanita. Oh, wait, your microphone's off, Vanita. There you go.
Sorry. One thing that struck me seeing this, and I've seen it before, but this time what really struck me was the vast chasm that exists between the struggle and the solution. And the line about saying it's time we start treating diseases above the neck the same way we treat diseases below the neck. It would just be so wonderful if people who were struggling with anxiety and depression and lots of other kinds of mental and emotional health issues could understand there's treatment. That chasm doesn't exist between a broken leg and a doctor that can help with the healing. And we just need that kind of sea change in the way we look at mental health issues, anxiety included.
Yeah, thank you. And Vanita, can you just tell us a little bit about your role and what you're doing with the foundation?
Yes, I work with Grant Halliburton Foundation, which was founded in 2006 following the suicide death of my son Grant at the age of 19. And I started it because I realized after he died that I did not know everything I needed to know at the time I needed to know it. And so our vision and our mission are based on educating people about mental health and suicide prevention. And we do that in schools and communities across North Texas.
Thank you. Such an important message for everybody here tonight. Jason, I'd love for you to introduce yourself and tell everybody who you work with and just if anything resonated for you specifically from the film.
Sure, thanks, Karin. I'm Jason Isham, I'm the Director of Integrated Behavioral Health for Children's Health. And in that role, I lead our school-based telebehavioral health programs, of which we have several here in Grayson and Fannin counties. And then I also lead our integrated behavioral health programs as well in primary care medical clinics. So really the thrust of all of that is to take behavioral health care to where people live and where kids play and where they are. And so the thing that really resonated for me, and it's really the reason why I do what I do and have for 20 plus years, is that someone's anxiety or their depression or their trauma experience doesn't have to define who they are. It can be a chapter in their book of their life story that, but they can really decide what role that will play in their life, and it can be a springboard to help others. Something that you've done, Karin, in your life with your struggles and sharing that with the world through Angst. And so it just really gives me hope that, again, whatever people are struggling with tonight, it doesn't have to define them moving forward.
Such a good point. Thank you, Jason. Jennifer, how about if you go ahead and introduce yourself?
Yeah, hi. So I'm Jenny Hughes, and I'm a psychologist and public health researcher at the UT Southwestern Center for Depression Research and Clinical Care. And we have been happy to collaborate with Fannin County on a couple of different projects through our Risk and Resilience Network, where we partner with schools to do a mental health promotion and suicide prevention program. And my research has always been in understanding the best ways that parents can support their kids and teens when they're struggling with depression, suicide, or anxiety. And so I think that was the part of the film that really stuck out to me, was when they started talking about some of the solutions and some of the treatments that are out there. I loved how the kids and teens just had like the names of all the interventions just rolling off, you know, that they would breathe and they would like name it to tame it, and, you know, all these great strategies of exposure that really do work. And when I was in graduate training, I worked at UCLA for a while, and they have a really strong anxiety program. And there are fantastic treatments for anxiety that are out there. So I appreciate the work of people like Jason who help make those more available in the community. And I hope that everybody watching tonight leaves with hope that if they're worried about their child, there are things that can help. And, you know, I know there's some great resources that were just put in the chat. So hopefully people can get connected.
Yeah, and thank you for mentioning that. We're throughout the panel tonight, we're going to make sure that those resources get in the chat, and that we're going to mention several of them as well. So I just want to make sure we go around the room here. So Krisha, I'm going to have you go next.
Hello, I'm Krisha Martin, and I live here in Sherman, Texas. I've been a therapist for 21 years. Primarily, I work here at the Behavioral Health Hospital as an intake counselor. I see patients when they're in a crisis. It's when it's at the worst that it can be. So I see the more extreme cases of anxiety and depression. I also, within the hospital, I work with the family medicine residents, and I help with physician wellness. There's a new push for physicians to take care of themselves so they're not burned out and they're not making bad decisions, and they're able to help their patients better. So I'm also sort of a therapist for the residents and just helping them get through life. And of course, a lot of them are very high achievers. They deal with anxiety. They probably always have, even to get where they are. So that has been an interesting experience as well. But in the film, I just have to say, I have to take off my therapist hat and just put on my mom hat. I really related to the father-daughter talking when he was saying, like, it made me mad how she acted. You'd think I'm a therapist, I'm pretty laid back. No, I'm pretty rigid and I'm pretty structured. And when my daughter was struggling, I had to take a look at myself and my own values and my own parenting techniques and kind of be willing to change it. My daughter started school right around the time that Sandy Hook had the shootings. And so at school, they started doing intruder drills where they would tell the kids, get under your desk. We're going to turn out the lights and we're going to practice what to do if an intruder comes to school. Well, that sent my daughter into a tailspin where she didn't want to go to school. And I couldn't tell her, you're going to be safe no matter what. That wasn't appropriate. I wanted to just get angry with her and push her out the door and send her to school. But what we did every morning, we would get ready upstairs and go downstairs and eat breakfast. And I just always had this rule that you would never watch TV at the table. But because of her anxiety, just getting her to school, her stomach would hurt so bad. We'd spend the morning, we even had to get up early to spend morning like in the bathroom. I started letting her watch Ellen in the morning and it worked. It totally worked. She needed just 15 minutes of distraction while she was watching Ellen. And we laugh about it now. We even wrote Ellen a letter to tell her how much she helped us. And we never heard back from her. But that really struck me because I think as parents, we tend to get set in our ways and think that we're right and think if we just stay in our path that the kid will eventually adjust. And we need to adjust sometimes. That really was important to me. That really struck me.
Such a good reminder about the distraction, you know, and as parents looking at our own anxiety first, you know. Thank you. Aileen, I want to make sure I'm pronouncing your name right. Is it Aileen or Eileen?
It's Aileen. Hi, my name's Aileen Hayes. I'm the coordinator for counseling in Sherman ISD, and I live in Grayson County, here in Grayson County. And my background is I worked in school mental health in Austin, and I had a private practice in Austin, and I had a lot of teens with a lot of anxiety. So I loved what really impressed me with this is the hopefulness of it, because I love it that you start saying that anxiety is difficult but treatable, and it's so true. It's treatable. And the other thing I really like about this movie is the voices of the teens, and they're talking about what helped them. Sometimes it's really pretty simple things, like we have this idea in our head that like my problems are big and the help I'm going to get has got to be really big and complicated but it's not really. A lot of times the things that help people with anxiety are very, they're simple, like talking to a friend, taking walks, breathing techniques, getting involved in something you enjoy. They're simple things and they work. And so I liked that message in this movie.
Yeah, it's like, especially if we can learn, just preemptively, right? Learn early on some of these tools. The younger the kids, the better that they're learning these, so that they're learning those tools when they do feel anxiety, because they're going to, that they can actually, that exposure exercise every single time, right? That they feel that anxiety and then try these tools and it helps them get out of it. Then they have a little bit more of that foundation of success each time. So yeah, it's my hope is that the word will get out and these tools will become something more prevalent in elementary schools. Grace, thank you for waiting. Please introduce yourself and tell us a little bit about you.
I'm Grace Thomas, and I'm a licensed chemical dependency counselor. I'm a private practitioner in Fannin County. I live in Bonham. I have a farm, and my office is located on my farm. And there's times when I integrate some of my animals in with my clients who have really bad anxiety, especially for first meetings. So I try and make it as comfortable as possible. I absolutely loved this film. It was amazing to see these kids and these adults who are, just pushing through each day. It's wonderful. The majority of the adolescents that I am seeing have been self-medicating their anxiety with marijuana or alcohol. Xanax is a big thing. Occasionally they're getting a hold of their parents' painkillers, and they're just trying to get through each day. And the way they do it is by self-medicating and falling asleep at school and so on and so forth. So a lot of the techniques I try and help them with is to, divert from that and try some of the actions, the action techniques that were presented, like many of them was presented in the film. But I took like 3 pages of notes and I was texting one of my adolescent girls about how excited I am about the video. She wasn't able to watch it tonight because she had something going on, but we're going to have a fantastic session next week with a lot of the information that I jotted down and from the experts that have shared some of the things that they have dealt with too. So I appreciate all of you. Thank you so much. Thank you.
Hopefully she'll have a way of being able to see it as well. The kids in the film were so brave. I mean, some of them had never talked about their anxiety before, called it film therapy. I told them all that once they were filmed, they could make the choice and see it once it was cut, whether they wanted to be in it or not. And all of them decided to. And a lot of them speak on panels with me now. It's pretty cool how the film itself has been like an exposure therapy session. So I have so many questions, and we had some are rolling in here. So I just want to start with a really popular question with Vanita here. You maybe can help me answer this. I'd love to hear your thoughts about this. But when somebody's struggling with anxiety or depression, how do you tell the difference between what's normal anxiety and when is it time to really get help? How do you know whether it's the moment of despair that you really need to worry? And I'll just share from that one tip that I've heard, and I'm curious if this is what you feel as well, that looking at those anxiety symptoms and seeing if they increase in intensity, frequency, and duration. If they're increasing in those 3 ways, and it's probably time to get it checked out. So fill us in a little bit. I think that'd be super helpful.
Well, I think that when a young person or a person of any age really is struggling with a disorder, mental or emotional disorder of any kind, whenever it starts to worsen and it starts to feel like it's just going in the wrong direction and it starts to bring a person down in lots of different ways, I think cause for concern is you don't want a person to give up hope. You don't want them to feel like they are helpless to change their situation. And because when they really start to spiral downward, some other concerning signs can show up that could indicate that they're truly giving up on life. And those are the things we really need to look for. We all know, I hope, that if a person is struggling with anxiety or depression, that there's a point at which it just makes sense for you to get some help for this person. But if you're asking me, what about if it goes beyond that? I think there's several signs to watch for, and they kind of fall into three areas: mood, behavior, and things that people say. So if their mood starts to really, they become way more anxious or depressed, they're exhibiting a lot of rage or irritability or feeling hopeless, that's one thing to be concerned about. Changes in their behavior might be increased use of alcohol or drugs to self-medicate because of their pain, acting restlessly, isolating, withdrawing from everything and everyone, maybe even visiting people to kind of subtly say goodbye or giving things away. These are a lot of things, but if you see 3 or 4 of these things, then you want to ask some questions. Especially if they start talking about being a burden or feeling like they wish they could go to sleep and not wake up. They just are so tired of life the way they're having to live it. So I think that, if you see those things, it's really important to get to the emergency room, frankly, because if a person gets to that point of despair, they can act on those feelings really, really fast. You don't want to leave them alone, and you want to get them help immediately.
Yeah. Super good point, like going to the emergency room, and better to be safe and go there and get help. And thank you for helping us to kind of think of just realistically about some of these signs, even though it may not be comfortable to talk about. Talking about it is what is going to help us actually be able to tame it and get pointed to resources. So thank you.
Sure.
So, Grace, Vanita mentioned drugs and alcohol. Can you share a little bit more? I saw you nodding your head down there. What are some ways, what is the prevalence of self-medicating?
Well, from my end of the business, it's pretty high. It's very prevalent with adolescents, and they're huge proponents for the marijuana being legalized. However, I have to tell them that even Oklahoma, you have to have a prescription for that, and you don't want to change all of your neurology and just depend on something to help you get through. And I like to bring up the point to them: do you like being told what to do? And they all say, well, no, I don't. It's like, well, now you're going to have marijuana telling you what to do. So when your anxiety starts to perk up, you're going to want to cut school, to go home, to smoke, to use an edible, to be able to, cope with it, instead of staying there and try and work through it and stay with your friends and your support. You're going to go isolate and then cause more problems for yourself, because then it cycles back around that the anxiety gets even worse, because what if my parents find out? What if they smell it on me? And they go and do all kinds of things. But I just see that it just seems to drive the anxiety more when they self-medicate. And so just trying to, hammer it all out and, just make it make sense to them. Everything that is being said today is so very, very helpful. And I'm just loving every bit of it.
Thank you, Grace. On that note about finding other tools to keep from you self-medicating to be able to handle anxiety, we talked about a lot of them in the film, but exposure therapy especially. And Jennifer, I would love to have you talk a little bit about exposure therapy. I've even had some people ask me, isn't it kind of mean to make people be pushed through to do things that they don't like? Can you talk a little bit about how helpful is it, and does it really work?
Yeah. So yes, it really works. That the short answer there. Anxiety can be treated through exposure therapy. It really works well for specific phobias. So if somebody has a really intense fear of something very specific, like flying, spiders, blood, needles, those kinds of things. It can also really help a lot with social anxiety. So I think you saw in the film the clip of the young man who went with his therapist to try on clothes and had to talk to the salesperson, right? And so you noticed before they went in that he rated his distress. He gave her that number. I'm at an 80, right? So we call that subjective units of distress, or SUDS. And exposure therapy basically helps people learn how to notice the signs in their body that they're getting to a certain level of distress, and to put that on a rating scale, and then to learn some strategies that they can use along the way as they notice that distress going up. One, to kind of push through it, because their thoughts in that moment will tell them that it's so terrible that they're going to die and they possibly can't make it through. So they learn to kind of tolerate that, and that they indeed don't die, right, at the other side of it. But also can learn some strategies to help kind of relax or bring themselves down if at a really high SUDS. And so in exposure, you really work to try to get them to tolerate it, because so many times people with anxiety start to pick up these strategies of avoidance where they just stay away from those situations because they, again, have these thoughts that it's really intolerable. And so you kind of saw the therapist work with him there to do that. Exposure treatment can be thought of as mean, I suppose, but with a good therapist who's really collaborative and motivated, it actually can be a really powerful treatment. And you can sometimes treat certain phobias in as short as like a 4-hour session if you're really kind of intensely working. You build a fear hierarchy together, so you don't throw people in the deep end to their scariest situation, but you kind of work up through different levels. And so as they get more practice over time, they're exposed to increasingly stressful or anxiety provoking situations, and then learn to tolerate them and or use skills to get through.
Yeah, the school that my son ended up going to, Waypoint Academy, which was in the film, was exposure-based therapy, and it changed his life. I mean, it really, really, really did. And Jenny, who's the narrator in the film, was his therapist. But it was every day of exposure therapy, and he's doing really well and thriving now, and still has social anxiety at times, but he knows how to handle it. And exposure therapy has been everything. He knows that rather than avoid, he's got to push through it and keep doing it. And so I'm incredibly grateful for exposure therapy. Aileen, can you share a little bit about some other tips that we can help use to handle our stress?
Yes. Actually, as you were talking about that, I was thinking about schools, and I kind of have I had a different thought when you were talking about the exposure therapy, and can I go there? There's so many, I think about kids in anxiety in school, and that's a very, there's a lot of that where school causes kids anxiety, or they're scared to go, and then their parents, don't want to make them have that bad experience, so then they don't make them go, and it can get into this big cycle. And so I loved that this film was talking about that pushing through, because that's such a I've seen that with attendance, where kids will miss a lot of school or not want to give presentations. And so I think this is some good education for parents, as far as like, it's not mean to say, okay, I know you have some anxiety, but let's learn some tools, and I believe in you, and, you're going to do this presentation, that's good anxiety treatment. And so I'm so happy to hear that, because I think a lot of times people get in the mindset of, well, they have anxiety, so, they can't do that. And that's just not true. So I think this is a great message.
Go ahead. I didn't mean to cut you off.
No, that's okay. I just, when you're talking about that, made me think about that. The thing that I've noticed a lot with managing stress and anxiety is that there's also, sometimes it's good to like look at the basic things. A lot of times when kids have a lot of anxiety, teenagers, one of the things 9 times out of 10 is that they don't sleep, like that they're up. What time do you go to bed? 4. That they're like texting with people till 4 a.m. or so I always encourage people to get those kind of basic things under control, as far as like a sleep schedule where you go to bed at the same time every night, and, without your phone maybe, or, and eating breakfast. And this sounds so basic, but it's really true. Like I've seen kids get better, their anxiety gets a little lower, where they can manage it when they go to bed, a couple hours earlier than they usually do, or, eat some protein in the morning, take a walk with their dog. That sometimes it's those simple things that will make a difference, because they're getting their body, sleep, good food regulates your body. Taking a walk, it's just a walk with your dog is huge, because you're outside, and the senses of being outside and what that does to your body. You're moving your body. I don't think we move as much as we're supposed to. So anyway, I really advocate for sometimes those simple interventions.
Yeah, you reminded me of something too when you're talking about being a parent, and just, not always knowing, or I should just say, it made me think of not always knowing as a parent when is our own anxiety spilling over into our kids? And people say to me, well, what exactly did you learn that was different? So I'm going to be totally concrete here and just say, what I learned was that my anxiety was so high, and I've learned to have a lot more self-compassion around that and to calm it down because of my historical stuff that happened, that when my son was struggling, and instead of making him feel capable, I was making him feel nervous. And he actually said to me after therapy, Mom, you say to me that you believe I can do it, but all I feel from you is fear. He could feel my fear, right? And so I had to really learn to be like, wait a minute, he's capable, and then believe it and put that energy out there. Really, it makes a difference, right? So modeling, and also modeling our own struggles and anxiety and how we work through it. Like, it's one thing you can do differently when you go home tonight, right? Is modeling for your kids your own self-compassion, learning through failure, and how you handle anxiety. So, thank you for bringing up some of those thoughts, Aileen, because it reminded me of that as a parent. So Krisha, I really want to talk to you a little bit about just crisis. How do you help us understand what to do if somebody's in a crisis?
Okay, well, it's kind of like a tree. There's all these different branches where it could go. Obviously, a crisis is defined by someone who's in immediate danger of harming themselves or someone else. And that can be a couple of ways. They're saying they want to harm themselves. Kind of like Vanita was saying, there's just a rapid change in their behavior or mood, or they're acting erratic. Maybe they're doing self-harm activity, cutting themselves, burning themselves, headbanging. Some of those things are common self-harm things. But I would just say if someone is a threat to themselves or someone else, don't hesitate. That's the main thing. Don't think, oh, I'll tell someone tomorrow, or I don't want to make them mad, so I don't want to tell an adult, or whatever the situation is. I just think it's really important to do something. You'll regret if you don't do anything. A lot of people worry someone's going to get mad at me because I got them in trouble. I told what they wrote in that journal or whatever. But you'd much rather someone be mad at you than be dead. And that's really important. And when we see patients come into the hospital, yeah, they're mad. They're mad at their mom or whoever, or their friend who they were FaceTiming with and called them out, and the police showed up at their house. They are mad, but when they're discharged, they're not usually still mad. That's just generally, that's the way it goes. And so that's really important. Also for parents, don't try to decipher, is this just a behavioral thing? Are they just acting out? They're not really going to do anything. Teens are super impulsive, especially male teens. They're really impulsive, and they could do something impulsive that's just completely irreversible, and they're gone. There's no getting help. There's no calling the crisis line. They're gone. So that's my main point, is just don't hesitate. In this area, the easiest way to get help is to go to the nearest emergency room, either TMC or Wilson and Jones emergency room, or you can also go to the behavioral health hospital. At our hospital, we're affiliated with TMC, but we see anyone 13 and up, and you can just show up in our lobby at any time. There is also another hospital in town called Caris, and they are also seeing even younger children there. I don't know exactly what their policy is, but I'm almost positive we're all bound by EMTALA laws, which means you can show up at our lobby at any time. So that's one way, and that's if someone's willing to get help and you feel safe getting them in your car. Sometimes someone is just really so out of their mind that they're pacing, they're not thinking straight, they're physically aggressive. And if that's the case, your best option, unfortunately, is to call the police. You can call the police to come out to the home. You do need to hang around because you need to give some collateral information. If the police show up and the patient is presenting really well, they're probably not going to do much. So you do need to hang around. And the police can walk you through the process of filling out what's called an emergency detention. It's just a simple form that you fill out that says why you think someone's in immediate danger to themselves or someone else. and then the police can transport the person to the emergency room for an evaluation. And just because someone goes to the emergency room or just because someone goes to the behavioral health lobby doesn't mean they're actually getting admitted, but at least they're getting an assessment by an intake counselor or someone. That's the main thing to know, and they can point you in the right direction. If you're calling the police, the police will walk you through this, but you do need to kind of let them know if you happen to know if there's guns in the home, if you happen to know if the person is expecting them or if they're aggressive. Just the police kind of need to know sometimes what they're getting into. Another way is if someone's at school or wherever and you feel like, or it's a friend's house and you feel like you can't talk them into getting help, you can just go to our local judge's office during business hours. It's just here on Crockett Street. Usually it's Judge Atherton, and you can fill out an emergency detention form there, and he will look it over with you. And if he feels like there's a cause for a crisis, he signs it with you, and then he dispatches a police officer to go out into the home to transport the person. And just because the police transport you to the ER, it's not a criminal offense. It's nothing that goes on your record. It literally is just a safety thing. It's just a way to get them the help they need. And then once someone's in the emergency room or in a behavioral health hospital, even in our lobby, it is secured. They literally cannot leave until they've been assessed by someone. So those are extreme cases, and I agree with what everyone's saying. You know, anxiety is really 100% treatable, and sometimes easily treatable, but it is just like diabetes or any other chronic illness. It is also 100% dangerous if you don't do anything.
Well, so on that note, thank you. So let's talk about those instances where it's not a crisis, but we are concerned and we want to help mitigate the problem before it gets to be a crisis, or before somebody's in a lot of distress when it's just really not necessary. So let's talk about some of those specific resources. And Vanita, I think maybe you can help me out with this. I know that we posted some in the chat, but sometimes it's not always so easy to find help. So let's put it out there to get people help.
That's so true. You know, you can ask anyone just about for a referral to a dentist or a doctor, but when we're talking about a mental health professional, we're reluctant to ask a neighbor, a friend, a coworker, or even family sometimes to help us find that. So here are a couple of free services that can help you find a mental health provider. One is herefortexas.com. It's a website that we created several years ago. It's a searchable database with over 900 North Texas mental health providers in it. And so you can go to this website, herefortexas.com, and you can search by all kinds of filters, like geographic location that you need, languages spoken, the issues that you're looking for help with, payment options, things like that. And it will pull up out of that 900 providers, it'll pull up a list of the ones that match your criteria, and then very detailed information on each provider that is generated by the providers themselves. So that's just designed to help people make informed decisions about mental health care, or to find them in the first place. So that's a wonderful resource. And then also we have a mental health navigation line. And this is a number that anyone can call to get information, guidance, or resources for mental health. So our navigators will talk with you. They'll help determine maybe what your next steps could be, or what you might need, what you're looking for. And then we will send you a list of resources that hopefully may fit your situation. Now that number is 972-525-8181. 972-525-8181, and it is available Monday through Friday from 10 a.m. to 6 p.m. So as I said, these are free resources. We're just trying to help people get connected. People who need help get connected with the people who can provide that help.
Thank you, Vanita. And Jason, you had some specific resources too, right, that I believe?
Yeah, certainly. So we currently provide school-based telebehavioral health services in several districts here in North Texas, particularly in Fannin and Grayson County. So we are in Bonham ISD and Denison ISD, Sherman ISD, Leonard ISD, Dodge City ISD, Sam Rayburn ISD, Trenton ISD, and that's that for now. If you are in a district that I didn't just list, then certainly you can ask your school counselor, and they can reach out to me, and we can discuss how we can launch the program at those districts who are not part of what we're doing yet. But again, any of those districts, if you have a student in that district, please feel free to reach out to your school counselor, and they can get you connected with our school-based telebehavioral health program or Teach That program. It's actually a state-funded program that's being replicated across the state of Texas. And so all across Texas, we are standing up school-based telebehavioral health programs to provide access to behavioral health care for students. So in Houston, Galveston, El Paso, Lubbock, all across the state, these similar programs are being stood up to provide greater access to care. There was a question, I think, in the chat about telecounseling and whether that's a bridge to in-person counseling, and whether adolescents actually benefit from that. And so our experience in our school-based telebehavioral health program is absolutely yes, students do benefit from virtual counseling or telebehavioral health counseling. In fact, we've been doing it since 2017. And in that time, we're actually seeing slightly greater improvements clinically in our school-based program, which is all virtual, than in our primary care integrated behavioral health practice, which is an in-person modality most of the time. And so we're actually seeing slightly more improvement in that tele modality than we are in in-person counseling. And I think that goes to the idea that students, particularly adolescents, are used to speaking and talking with one another over a device. And many times that video connection provides a sense of psychological safety, kind of what we were getting at earlier in our conversation, that sometimes people are more willing to share over video than they are in person. And so we are certainly seeing that in our practices. And so would encourage you to investigate those resources as well.
Thank you. I know time's going by so fast here, so I just want to acknowledge that for those of you that want to stay on, the panelists have kindly said that they would stay on for another 10 minutes. So we're looking through your chat here and want to answer some questions. I also want to let you know that if there's an email address that you can send if you have any questions after this, feel free to send, and Texas Behavioral Health is kind enough to be able to answer your questions. So Sean, who's in the back here, let me know if I have this. Oh, he just sent it. info@TEXOM as in Mary, AB as in boy, HLT.org. So if you look in the chat, there is the email address where you can send your question, because I know a lot of our questions, we have a lot of them in here, are not all going to be able to be answered. But I think for sake of time, what would be great would be to go around the room again and have each of you, if you saw a question in the chat that you really specifically want to be able to answer, or have a thought to share that you want to make sure you get across, please do. So why don't we just start with Aileen?
I wanted to jump in on something Krisha was saying about, I've also seen kids have a lot of anxiety when they're worrying about their friends. They look out for each other and they worry about each other. And she was talking about what you can do when you're worried about a friend having suicidal thoughts or hurting themselves. One thing that I've seen to be really helpful is crisis lines. There's the national crisis line. There's also a text crisis line now that's 741-741. But one good use of those is that teens can use those when they're worried about a friend, and they'll coach you right through it. And I've actually seen some big successes with that, where a teen that I worked with was talking to a friend who was in a crisis and wasn't sure, what to do about it. It's 11 at night, and the crisis line helped her. So I kind of want to throw that out there, because I know there's a lot of teens out there who maybe they're feeling okay, but they've got a friend they're worried about. And so that's a resource. There's the national crisis line, they're all over the place, but those crisis lines can help you figure out what to do to help your friend. That was a thought.
Yes, thank you. Thank you. Krisha, anything you else want to add as we end here? Oh, your mic is, there you go.
Okay. Well, I really can't think of anything specific. I just enjoyed the film, and I appreciate everyone who took the time to watch and listen. I just think it's important to realize there's so many different variations of anxiety and stress. And we're here to help you. There are resources around. I wish there were more, but there are some. You just have to look or at least get connected with the TBHLT on Facebook. I think that's really the best option at this time. So yes.
Thank you.
Appreciate you letting me be a part of things.
Thank you for being a part of it. Jennifer.
Yeah, I guess I put this in the chat for everybody, but one last thought that I had was there's a really great book called Fighting Invisible Tigers, and it's a stress management book for teens. It really does a nice job of building on the biology model of stress and how it impacts our bodies. You guys heard a bit about it in the film, right, with the amygdala and the frontal lobe and the way the cortisol kind of floods your system, right, and the impact that has on your stomach and your head and all the other symptoms of anxiety. Sometimes just learning that model can be really helpful to people who struggle with anxiety because it helps you understand what's going on in your body. And I think right now with the pandemic, we all have an elevated level of cortisol all the time. And that's why people are feeling so fatigued and so burnout. Yes, it's the change in our, routines. And yes, it's worries about the actual illness, but it's just also that we all have this kind of like buzz of stress right now. And so I think a book like that could be really helpful for parents to read as well, just to have a better understanding of that. And it goes into some of those strategies that the film mentioned in a little more detail. So I would recommend that if anybody wants an extra resource.
Tell us the name of the book again.
It's called Fighting Invisible Tigers, Stress Management for Teens. It's by Earl Hip.
Okay, wonderful. I love these panels. I always learn something every time. All right, let's see. Don't mind my my daughter walking through the background. Let's see, Jason, do you want to go next and close out?
Sure. So I think the thing I'd like to leave everyone with is, I think there were several questions around how can we make, this anxiety and behavioral health a conversation and change the culture of our schools and our court systems. And so there are a couple ways to do that. One of the ways is Vanita's team has a program called Thrive, which is really about making behavioral health and suicide prevention a part of the culture in a school. And so I'd encourage you to learn more about that. In addition, there's another program called Mental Health First Aid for Youth, which is kind of what it sounds like. It's like CPR for behavioral health, and it teaches lay people how to recognize and respond appropriately to teens who are struggling with behavioral health issues. We offer that at no cost to school districts. Across North Texas, and I think Vanita does too, and Region 10 does as well. So there are several different ways to access that training, but continue to have the conversation. I would say if you're worried about is this normal or not, talk to your school's counselor, talk to your primary care pediatrician, just reach out. Sean, you're happy, I'd be pleased for you to publish my email address to the group here as well. If you've called someone and you haven't heard back, email me and we'll see if we can't link you with a resource someplace. There's help out there and we want to get you the right resources. So
thank you, Jason. That's incredible. It's incredible. All right, Grace, you haven't had a chance to go yet. Here, let us know what really matters to you.
Everything about what the panelists have shared in the video. I love to add new things into what I'm doing with my teens and my families. And I just so appreciate all the information, and also getting to meet some of you virtually. And, I have sent some of my people to some of the hospitals that you guys work at. And I appreciate all of the help that you provide to them, and especially the comfort that you give to the families. I had to go to the behavioral health center, and I was going to go see one of the kids that I was seeing. He had been admitted, but they weren't letting anybody else in. But one of the nurses came out and talked to me for a little bit, and she was just wonderful. And, the compassion that the staff at each one of the hospitals shows for these kids is just great. And I love being able to tell the people that, when the parents are calling saying, oh, I had to take them to the hospital again, that, just give them that reassurance that all of these professionals are on their side, and we're all going to work together to save their kid's life and just do what it takes. So thank all of you for everything that you've been doing.
And Vanita, did I let you close yet? I don't think so. So please go ahead.
I just want to say that to parents out there, especially if you are worried about, concerned about your child, as if you do the same thing that you would do with any other treatable condition. Early intervention is best. And, you know, just start with your primary care physician or pediatrician. They are capable of helping to get the ball rolling and diagnosing anxiety and depression. And that could be a stepping stone to you getting connected to other specialists if needed. But take a step in that direction. Don't hesitate. Left untreated, like most medical conditions, condition can just get worse. And so it's just wishful thinking if we think they'll outgrow it or go it away. Get some professional help with that. And we're glad to help with that if you need some.
Well, you know, I have to say that I think Grace wins for like the best therapy animal tonight on the call. Just reducing my stress just by looking at your cute dog. Pet therapy. But I want to leave everybody just with saying, you know, Texas Behavioral Health, everybody that's been on this panel, thank you for caring enough about this topic and understanding how much everybody's going through such added stress right now with all the uncertainty that we have in our lives, and not being afraid to talk about the really hard things. You know, there was a lot that we talked about that was a little uncomfortable, and I'm grateful for not only everybody that talked about it, but those that listened to it, because science and research shows that the more we talk about it, actually that lessens the effects and more people get help than the other way around. So just, you know, thank you so much to everybody tonight. And I learned a lot as well on the panel. It reminded me as well, kind of, to with my teen daughter, I've got to stay in that modeling my own anxiety resolution and self-compassion. So thanks and have a good night. And remember everybody that you can email if you have more questions to info@texomabhlt.org. All right, have a good night.